let's talk about a symptom in menopause that is, I think, not talked about enough, pretty much because it's a personal topic. So I'm just going to say it. Let's talk about vaginal dryness and atrophy. Atrophy is another word for kind of a degrading of the tissue to where that vaginal tissue feels sandpapery or tissue papery, where it doesn't have the volume or the moisture that it used to have. So with vaginal dryness in menopause, the main cause of this is because estrogen has dropped, and estrogen is important to support vaginal tissue. Sometimes this isn't as big of a problem for women and it just doesn't cause that many symptoms. Sometimes it can be really life-altering to where it's uncomfortable and painful and can affect your day-to-day activities and anywhere in between. Definitely one of the activities it can affect is sexual activity, and sometimes postmenopausal women with vaginal atrophy stop having intercourse because it can be super painful. Another thing that I see often that isn't talked about enough is that you can start to get, as a postmenopausal woman, UTIs or urinary tract infections that are recurrent. And you wonder, okay, well, I've never had these before. Why am I getting these now? And a big piece to that puzzle is that you no longer are making estrogen to support your vaginal tissue. And then that vaginal tissue, you have a microbiome in your vaginal tissue, in your vagina, kind of like you do in your gut. And that is important to have that good bacteria in your vaginal area to protect you against the bad bacteria that can grow. And if you have an imbalance there in the bacterial load, then what can happen is you can be more prone to urinary tract infections. And then we continue to give you antibiotics for those. Well, then we've just ruined even more of your good bacteria down there, and you get more prone to urinary tract infections. And then that tissue is also just not as strong and not able to keep the bacteria out. So the solution to this oftentimes is to give women a little bit of estrogen that you can put in gel or cream form in the vagina. And what that does is then it helps build that tissue back up, which can then support a healthy pH and a healthy biome down there to prevent urinary tract infections. So if I could pick giving you a ton of antibiotics over and over again versus giving you a little bit of vaginal estrogen every time, it's going to help your quality of life. It's going to help your ability to have intercourse without pain and just the discomfort of vaginal dryness too. And the cool thing about this estrogen is it's really local. It's just called vaginal estradiol, and I can prescribe it and send it to a normal pharmacy. And typically you just apply it, or for lack of a better word, stick it up there. And you really only need to do this once or twice a week. And it keeps that vaginal tissue healthy and can prevent urinary tract infections and prevent the discomfort too. So maybe a little bit more than what you needed to know, but it's good to know this beforehand before you start dealing with the issues of vaginal atrophy and UTIs that we can get on the preventative side of this, keep you healthier, keep you away from antibiotics, but also help with any discomfort that comes along with that vaginal atrophy.